Hi, everyone. This is Dr. Vivi with a close colleague of mine, Dr. Ellini. For those of you who do not know, this is the first in a series of Doc Talks. I couldn't be more excited to launch with Heart Health Awareness Month. As Dr. Ellini may know, I'm passionate about two things. One, he knows about cardiovascular health. The second is poop, but that's for another talk. I tell my patients I'm passionate about poop because you learn so much about how healthy someone is by the way they poop. But Dr. Ellini, we're going to have you talk about the heart, pediatric preventative tips. That's the point of Doc Talks. And can you start by telling us a little bit about yourself and, of course, how we met, which was one of my favorite stories?
Sure. Thanks for having me on, Dr. Vivi. I appreciate it. And this is timely to have this discussion in February. So I'm from actually the East Coast. I grew up in the DC area, and my training has been in Pittsburgh and DC, and I've been out here for about 10 years now. Wow. To this in Southern California. Almost, 10 years ago. So the way we met actually was we both, we moved here, we moved in an apartment complex and for a while, for about a year, and I was at the gym, and I met you. You were working out, and you had a pediatric journal with you. So I just, started having conversation, and we figured out that I'm from DC. You said you had a sister who lives in DC, and then she's a lawyer, and then she's in Iraq, and I'm like, wait a minute, this is really interesting because we really know a person who was a lawyer in DC who's been in Iraq, works for the State Department, and then so somehow we both made the connection that your sister was one of our good friends while we were in DC, and so that's how we met, and we've been friends since. So that's my story, and I'm glad to be here and have this conversation with you.
Thank you. Thank you so much for being agreeable to the trial and error of a first session. We picked together some preventative topics because the goal for me is for children not to ever need to be on medicine or require any specialist, period. Of course, there are circumstances I'm going to ask Dr. Ellini to comment on regarding familial history of arrhythmias, things that people should be looking out for, COVID-related heart conditions, etc. But I asked him to start with what he would love to tell friends, family, or patients in his office that is the most high-yield preventative tip or tips. And I pointed out a few things that I see and asked him to comment on hypotension and orthostatic vasovagal hypotension, but I asked him to share what he thinks would be a useful tip for families regarding heart health for life.
Sure. No, I think this is obviously a very important topic. And so I think the first thing that I always speak about, so as a pediatric cardiologist, we train for 3 extra years to just learn about the specific heart diseases that kids are born with. So that 1% of congenital heart disease that potentially need, intervention surgeries. But what I've found out in the last 15 years is really that as we've seen the obesity epidemic, and kind of rising in this country and around the world, is that my job is even more, yes, take care of the sick kids, but, I want to hand these children off, into the adult world, not ever having to see, hopefully, an adult cardiologist. And so just like your job is to, try to hopefully prevent them from seeing specialists, and if they need it, obviously they need it. But my job is to try to prevent them, being in the hands of adult cardiologists who obviously do an excellent job, but, but they, they are a little bit more, I think, medicine, happy than we are. We try to prevent, as much as we can not to use medicine. So I'm there with you. So I think the biggest thing, from a preventive perspective, we can talk about the other congenital heart diseases and other things that obviously put kids at risk. But I think the biggest thing that is putting our children at risk and most likely the next generation will live less than our generation in regards to length of time because of cardiovascular disease is that, I think number one, sugar, right? I mean, and the preservative, rich foods that unfortunately our children, are eating. And so that's usually when kids come in to see me, be it for obesity or hypertension or hypercholesterolemia, that's what I really, really focus on, and I spend most of the time in the first visit, not talking about medicines, not talking about, their weight. It's really trying to say, look, you as a family need to figure out how you going to mitigate this, right? Because a 10-year-old is not at fault. They're this much at fault, and it's usually the family's, the problem that they need to really get around, eating healthier and exercising more. And those are easier said than done in our, where we live and how we live our life now. So we really just talk about not yo-yo diets, right? Ups and downs. We talk about something that can be.
Can I interrupt you?
Yeah, please.
This is so interesting to me because as a pediatrician, of course, I focus so much on diet. Diet is preventative for cancer, for heart disease. And I notice whenever I'm checking cholesterols, we have high triglycerides that when I research to help parents decide how to change diet, it's sugar. But I don't ever focus on the sugar intake the way you're saying it's so important. And you mentioned to me earlier sugar and inflammation. Can you speak to that to even educate the other doctors out there? Because I will talk to till I'm blue in the face about, I explain how frosting and oil, my best example is talking to kids so the kids understand, which of course it's really about educating parents and having parents set strict boundaries that you don't get dessert every night, that kind of thing. And setting a model, not bringing the food in, but frosting, pizza, the oils that you have to wash off your hands so vigorously with soap. I like them to visualize that in their bloodstream and how you need HDL, which DHA, whatever, however you get high DHL from HDL from eating healthy. I talked about how you have to wash that through your blood, but I don't speak about the sugar, and I think that would be great for you to, even in a non-scientific connection, just tell us how they're connected, how you see sugar affecting heart health.
Yeah, sure. I mean, that's definitely, obviously saturated fat, all those are extremely important, but I think our epidemic and pandemic right now in obesity is, is preservatives and sugar, in my opinion. And I think if we can really decrease that amount, it will be good. So sugar, sugar in itself obviously produces a huge surge in insulin, right? I mean, every time you have, low fiber, high sugar intake, right? So sodas and juices. So that's the first thing that goes in my office, right? As most of us try to tell our families.
It's a mandate.
Sodas and juices.
Yeah, that's universal in pediatrics.
Yeah.
No juice.
Right. So, no juices whatsoever. So I think, with those insulin spikes that you get throughout the day and multiple times, right, you basically produce and start this cascade of, kind of a hormonal, a balance, or should say imbalance in your body that is triggered every hour, every 2 hours with these, finely, highly refined sugars that literally spike your insulin. And that produces a whole cascade of hormonal imbalance that basically puts a huge amount of oxidative stress, right? Increases your cortisol, and that in itself, right, starts producing inflammation. And it goes into the, metabolic syndrome, which is a whole, that itself, unfortunately, as you are, I think, a champion of, no metabolic syndrome, right? But I think that's where we're getting in trouble with our, young children and and really young teens and teenagers, and as you said, it starts at I remember when I was training in medical school, and maybe you were training, it was always a cute 2-3-year-old. Oh, you're a chubby little 3-year-old, right? But we don't speak about cute chubby 3-year-olds anymore, because that cute chubby 3-year-old, unfortunately, is going to be the obese 10-year-old in 5, 7, 8 years, right? Yeah. So I think we as pediatricians.
I'm glad you brought that up, because I finally got around to posting how many calories each age group needs, and it's in one of my recent blogs. So useful. It's incredible how little we know. I also have broken down the carbohydrates and fats by age, but starting at 2, we look at their body mass index. But starting at 1.5, if I know, and I'm probably headed there with my chunky 1-year-old. I mean, she's 99% all around. And she's just breastfeeding. She refuses any other milk. So she's just inherently ready and set. And this is the story I get all the time. They are eating so healthy. They eat, all of the right foods, but they're still obese. So that we have kids who are skinny fat, and then actually high BMI. And so both of them, though, have just an equal risk, correct? And that's something that the skinny cross-country runner who's eating poorly and has a terrible diet, if you look at their blood, you can see all the same markers of somebody who's overweight and not eating well, correct?
Oh, very true. And I think, as we get into the preteen teenage years, I try not to focus on the weight when they come in, because I think it's such a sticking point, especially with our children and young adolescents. So I never try to talk about weight. All I talk about with them is the fact that, you want to be heart healthy. And we go through the, no juice, no, that's the first thing, no soda, right? And we get to the fast food, and then we get to, but, really it's not about the weight, because obviously, especially with girls, it produces a psychiatric issue, I think, that they definitely don't want, right? I mean, moving forward psychologically, but but then they start doing these yo-yo diets, right? And they never really get to the meat of the problem, which is this, hormonal imbalance, right, that they're having in their body, right? That will really continue for the rest of their life if they really don't set up a heart healthy lifestyle that they can maintain, right? And I tell them, I'm like, look, the weight will come off, right? The goal isn't for you to lose weight. You didn't gain this in 5 years. You didn't gain this, you gained this over how many years? 15 years, depending on how old they are, right? And so it's not that you're going to lose it. I don't want you to lose the weight. I just want you to focus on eating. And that's the, so if they're really obese, and unfortunately, which, most of the kids with hypertension, and cholesterol issues that come see us, they're overweight, obese. So I say, it's, I want you to get heart healthy and not focus on the weight. And I usually tell them, for the first 6 months, we're just going to do nutrition. If you can't do nutrition, diet, and exercise, you're just too much for you, right? Let's just forget the exercise. You can just sit on your bum all day long. I could care less. But if you're going to focus on something, let's focus on diet, and then we'll get to exercise, because some people just can't do it all. And that's okay. Like you got to change the pattern, and you got to change your mindset, right? And so giving them very specific guidelines for a specific amount of time, like 2 weeks, 3 weeks, 4 weeks, that at least, hopefully, and I'm batting 20%, honestly. 80% don't care. They never see me again, and they actually don't like the way I speak to them about their, be it weight, cholesterol, and that's okay. I can only do what I can do, right? But those 20%, they really, and it's the families too, it's not just them, and they make a difference for themselves.
I want to tell you, because I'm so involved in metabolic syndrome and changing even adults, if you're reaching 20%, that's amazing. Even the most expensive programs can barely get 4 to 5% of people to change their habits. So, but that's what I love about pediatrics. I have a handful of parents who are, you would not know that what they're eating at home, because they look fit. They have a terrible diet. They don't even know until they come to meet me that croissants for breakfast are not a good idea. You're just a lost opportunity for nutrition. I can't believe what a difference it can make. And I'm so excited to hear you speak as a cardiologist, that you talk about nutrition as the most important piece, because I have to combat, I'm sure you do too, no, but my child is running, but my child's doing this. Oh, he's just overweight right now because he's not exercising. It's never linked to that. When people are thinking, I'm going to eat and exercise that food away, that's just not, you eat so you can exercise. It doesn't equate the other way. And you really have to just think about healthy diet, period. Whether or not, there's going to be times like a pandemic when you can't exercise every day. But if a child knows what's healthy and listens to their body, it will make no difference whether they're exercising or not. And that's always the excuse I hear. Oh, they're just a little bit overweight right now because they're not exercising. And it almost gets worse once they start exercising, because that their mentality is, once I exercise, I can eat what I want. And it really doesn't work that way. I always tell people to take a big drink of water before they eat their lunch if they were just exercising, because your body confuses thirst with hunger. So I'm so glad that you focus on that portion and talk and dispel the myth that it's just because we're not exercising right now, and we just need to exercise.
No. Yeah, and one more thing I'd like to say, I think this is unfortunately our politics, our government, our money driven, everything. And the fact that only like 7 companies control all our food products, unfortunately, in this country, is that the big thing about a calorie is a calorie, right? I mean, I don't know, people like use that term. Well, if I'm just it's a calorie. So if I'm eating 1,500 calories, but if it's all sugar with no good protein, good fat in it, the calorie is not a calorie. And that's another thing that a myth that I try to undo in people's when they they come here, is that a good calorie is a good calorie, but that sugar laden calorie is not, because that insulin spike is really important. And the other thing that I talk to, one more thing on, on this is that, I agree with you that there are plenty of thin people out there who exercise every day, but they're really dying inside because, they're not eating well. And there are plenty of overweight people out there who are really healthy and just their metabolism is different, right? So again, that's why I don't focus on the weight so much with the children and adolescents who come to our office. And I always scare them that, a little bit. Unfortunately, I've had people who cry out of my office, but that's okay, and that's, and I think some of them come back, some of them don't. And the 20% might be an over exaggeration. So, so maybe
no, better at your office. We don't have to have the ongoing relationship because I want them to feel comfortable here. But I've learned they turn off their ears when they hear one word because it is very emotional and we're not trained psychologists. So I once said something right when I was beginning my career as a pediatrician, and it came back to me that they left there thinking I told them they need to look like a runway model, and I had said the exact opposite. But it's very difficult combating that. So you just have to do the best you can, trying not to hurt a fragile ego because their self-worth is just based on this period in their life. They actually, adults tend to view themselves as they do during their teen years. But some of the things that we put out there to discuss that actually are related to our conversation right now, I'll just throw out there some questions. And we do have some viewers. I want to encourage anyone to write some questions in and we can actually answer them for you. And coconut oil. What do you think about coconut oil? Maybe we should talk about that after we talk about lipid profiles, but it has gotten so much hype, and when I read about it, I happen to have had high cholesterol since I was running. I couldn't have been running, sub 6 minute miles for 7 miles in training, running in college, and I looked like I should have been eating more, and I couldn't possibly eat more, but I'd have ranch dressing on my salad. I had high cholesterol since I was a teenager. It runs in my family. So I read a book that really was impressionable, and it showed a plaque outside. It was just like a solid rubber mass that was removed from a coronary artery. And that's how, for me, thinking about the foods I'm eating and how that goes right to blocking my heart. Now, I see people loving coconut oil who have high cholesterol, and that scares me. What do you have to say about that?
So again, I think, the biggest thing is everything in moderation, right? But in regards to coconut oil, I think that there was about 10 years ago, there was a lot of hype about it. But over the last 4 or 5 years, there's been, again, you got to realize that none of these have, you can't really do a randomized trial, right? So it's a lot of, so the studies aren't great. But the last 2-3 years, some studies are showing that the theory was that basically because it would increase your HDL and there is potential that it would decrease your LDL. But the last few years, multiple papers have come out that said, really, we don't know. So, and some have said that actually can do the opposite and increase your LDL. So I think people just have to, realize that it's not the panacea. It's not going to be the oil that's going to change. Now, if you want to use it once in a while, sure, just like everything else, right? But I think that, extra virgin olive oil, right, is probably still the oil, I think, that people, the studies have shown, right? So coconut oil, I would really be careful with, just because the studies have not really, the 2020 review actually just said, I'm reading because I looked it up for you, further research is needed to ascertain the appropriate role for coconut oil in cardiovascular health. That was 2020. 2018 analysis showed actually it's bad for you. 2016 review said there were no well-controlled studies. So, but, it's 90% saturated fat.
That's the bottom line for me. That's the bottom line for me. So I think when you say everything in moderation, you can have a little bit butter. I got a call because I'm so strict about my son's diet. We do have a couple questions here. And I got a call on my way into work because he wanted to, the nanny was going to use butter, and we happened to have little packets of butter, but he was going to have grilled cheese, which was a treat after he had his vegetables, whole wheat bread, grilled cheese. And it's the easiest thing when I'm not there, my husband's not there, because with diabetes, we've been controlling his diet. And I said, just skip the butter. He's having cheese. you know, that's enough. Or use olive oil, and you can melt the cheese and then flip the bread onto the melted cheese because you're already getting that fat. My husband had already, he's like, you're right. That's what I do when we do tacos or quesadillas. I don't add oil. But can you speak? We actually avoided for years extra virgin olive oil. And that was because they said cooking with it is dangerous. And they said, oh, no, it's fine. But again, everything in moderation. Do you have anything to say about extra virgin olive oil for cooking? It was many review articles that we had to look through, and we found the latest that it's safe. I'm not sure you're even up to date with that.
You know, as far as I know, I think it's safe to use, and that's the oil we use mostly for most of our, be it cooking or salads, and in our food. So I think that the Mediterranean diet, which includes the extra virgin olive oil, we use avocado oil as well. I think both of those, are pretty good. And again, it's in moderation. I think so. Yeah, I think it's fine. I think both of those, the extra virgin olive oil, I think would be my choice for if you're gonna use oil for cooking and eating and putting it into your food. So
okay, here are questions.
Sure.
From my friend Danielle. Can kids eat too many fruits? Are some fruits better than others? And should children stop eating by a certain time of day? So you can speak to one, and if I can remind you of the second question.
Sure. Again,
if you
my motto is,
yeah.
Pardon?
If you don't know, you don't know. I'm not.
No,
we're
no.
Not as a nutritionist, I'm happy to say what I know.
Yeah.
But
sure. Again, my motto in the office is, don't drink the juice, eat the fruits, right? So that's number one. Number two really is, I think all fruits are fine. Remember in our, olden days, we ate fruits based on availability and based on the seasons. Now everything is available all the time, right? So, I don't know if there's actually any bad fruits even for children. So, your staples are fine. I would say I don't think there's any, but you might know more than I do about this. But.
I do. So there, with the if you're talking about I'm putting together some dots. If you're telling me glycemic index, insulin, you can look up a glycemic index of a fruit. So there's absolutely some fruits that are better than others. Berries, incredible fiber, antioxidants. I trained for 10 years at the Sears Clinic and they have amazing books about heart healthy and the healthiest kid on the block. I love Bill Sears and everything he's done for pediatric preventative diets and health. So you can look towards berries, look up glycemic index of fruits, and you can see the ranking, and that's for the release. And I've only learned more about this with my son being a newly diagnosed diabetic, and it's quite fascinating to see the difference. I love what you said about juicing. It's something I'd like to remind all of my patients, especially when a child's overweight. They'll say, oh no, we juice so much, and the child loves that really healthy juice shake, which is by far some of the healthiest stuff I've heard of, but they're overweight. And when you drink, you don't satiate through the brain, the chewing mechanism that you're full. So I try to tell those families, try to avoid the juicing for a while and see if they will eat those foods. Or they change the diet so the juice is incorporated into the meal as calories, and looking at how many calories the juice is. It can be an incredible amount of calories. So yeah, some fruits are better than others if you actually care, but some people are just at the level of, how do I get them to eat apples instead of French fries? So, it's all relative.
Yeah, and I think it depends where you are. If you're already a healthy family, yes, I agree. The blueberries and the blackberries and the raspberries and, strawberries, obviously, yes, much better than
you can afford it.
Right, which should be all organic if you can afford
Just
it.
because you do know. Okay, go ahead.
No, and I agree, but yeah, so I think, for the general population right out there, I think any fruit, as long as, and then juicing, the other problem with juicing, yes, I think the mastication and the chewing, basically introduces, the saliva on your brain, but also the fiber. When you juice, unfortunately, a lot of the fiber goes in the trash can, and that fiber, because any fruit that we eat, right, and especially the apples and the oranges, and the pears, and they have a lot of sugar in them, right? But it's obviously good sugar. Well, it's sugar. Let's say sugar, but it's the fiber in those that you eat that slows down the absorption, decrease the insulin spike, right? And that's why that's why that you don't have the deleterious effects as much. Obviously, forget the vitamins and all the good stuff that goes with it. It's the fiber that is in the fruit that makes it different.
Is it correct that the fiber will actually bind some of the fats in your meal? So you might lose that.
Right. Yes.
Yeah. And then I thought we could come back to fiber or talk about some good options, but what do you think about stopping eating at a certain time of day? You were talking about cortisol and that kind of thing. I don't know. I always say the studies have been so variable that in 24 hours if you get the same calories depending on when you eat it, it makes no difference. That's how I personally feel. There's been huge pushes about breakfast, but when I have overweight children who are fine skipping breakfast because they're not hungry, I don't know if that's correct. I don't want to say, oh, you have to eat breakfast because you'll eat less later. When I look at I look at what they're eating.
Yeah, it's really hard, and I think I'll give you my personal experience. About a year ago, I started this intermittent fasting, and I believe in it, and I've lost about 12.5, 13% of my body weight, and I feel great. So I'm a big believer in intermittent fasting. The more you push it, but with that, I've decreased my carb intake and so you have to do it, but you can't obviously do that with children, right? So for me, I've had 16, 17-year-olds who have really tried, and they're losing weight, and they kind of need to get over it. And I've said, look, go read it. I can't prescribe it, but I think you might benefit from it. But in regards to late, you always want to avoid eating late, right? I think that produces a whole set of different hormonal responses while you're sleeping. Right now, if the kids are at a certain age, they can sleep 10, 12 hours, right, without eating, right? Obviously, so I think you can get your children to sleep for those 10 to 12 hours without eating. Obviously, that's great. Breakfast, I think you have to take it into consideration. If that child goes to school and is hungry and is not paying attention, and then at lunch they're basically shoving their face with anything they can find, that's not healthy either, right? So I think that 3 meals a day for children is beneficial, as long as it's good fats and good proteins, and enough, to keep them, not, hungry every 2 hours, right? So you got to get the fat and protein in there in a healthy balance, especially in the morning. So at 9:30, they're not, getting a granola bar because all they had was just, a cereal with, all carbs, which will run out. I mean, that energy will run out in 2 hours.
So to answer her question about a certain time of day, I think in the general rule is an hour before bed at least.
Yeah, I think that's reasonable.
So what we do with my son, though, which has been great and works because he is excited to get up from the dinner table, the rule is you can get carrot. We have like a few things he can have. If he gets hungry later, we remind him of that when he's getting up from the table. If you're hungry later, you can have carrots or apple, and it's really just those two. And I picked those two because the carrots, both of them are good for your teeth as far as cleaning some of the sugars off your teeth. They have a potential to do that. And then you can also pick maybe cucumber, things that don't add calories and will be filling. But that really is a litmus test. Are they really hungry when they're asking you? And if they know they can only get carrots, my son won't eat carrots all day, but at night when he's hungry, he will go through a bag because he really was hungry. So that's a good trick to use.
Yeah, and then sorry, I was going to talk about cholesterol or lipids if you want to go into that.
While we're on the topic of diets, there is a question: is a keto diet? And now, I want to preface this just because I know with my son who's diabetic that when we met with nutritionists, this is a question for adults. So if you don't feel comfortable answering, you don't have to. But the question is: is a keto diet bad for your heart? And I'm going to let everyone know that there is no consideration for using a keto diet for a growing child. So that's not the conversation we're going to have.
Right. I completely agree. I think that.
I don't think this is just a question in general for adults. Because I've heard that too, that you don't want to do a keto diet. It's bad for your heart. Is that true?
I think, God.
I might get Dr. Fergani on if I can, and she would definitely, I know she's very keen on talking about keto diets. So
Yeah, I don't know. Look, I know the basics of it, honestly, but I don't know all the details about adult literature, so I can't comment. All I can say is that, for an adult, if you're trying to lose weight, I think a keto diet, decreasing, taking away carb will do its job in losing that weight relatively quickly, right? In the first couple of months, right? Long term, is a keto diet really healthy for for a heart healthy lifestyle? So to avoid, the cholesterol and all the issues we see, later in life? I don't know. Honestly, I have to look at the data. Since we don't prescribe it for children, adolescents, and, really young adults in a normal setting, I can't speak to the literature. But I know you can lose a lot of weight quickly, relatively, but all that fat, it's got to take its toll at one point or another.
Okay. I agree. But it's just everything in moderation. Like when you told me you're using avocado oil, I even feel like that might be a little too soon. Everything in moderation. I'll use a little. We have it, but we haven't gone through it like we do the extra virgin olive oil because we've had years and years of research on that.
Sure.
Okay, so you wanted to go and talk about another subject, and we've caught up on our questions. So I was going to segue into flaxseed, something I was going to recommend that people who are trying to find ways to clean up do easy changes in their kids' diets. You can add some flax, ground flax, anything you bake. Change what you're baking with. Just get rid of butter, olive oil. Everything can be substituted with olive oil. Sometimes I use the top oil of the almond butter. I pour that out, and then when I give my son almond, there's not as much butter in it anyhow. And then everyone needs to be looking at sources for added DHA in their child's diet. DHA versus EPA is somewhat up debate in pediatrics. I don't know if you want to speak to that, but those are omega-3 fatty acids that do add up to improving your HDL, which is the mop to clean up the bad cholesterol. So you can speak more on this. The last tip that I usually give parents, there's a huge resource of kashi cereals that you can use as snacks that have fiber and really clean. You'd like the concept that oatmeal is heart healthy. You have this potential to change what they're eating with quick, easy solutions like a kashi cereal or other products out there. But
yeah,
what would you recommend?
So I think the biggest thing is giving kids, making sure that there is variety, right? And that's easier said. It's much harder to do, I think, in the population, unfortunately, where we see a lot of the obesity and all this, metabolic syndromes, right? When both parents are working, 3 jobs, and there's food desert, and so I think that that's on a global perspective, right? So in home, I think talking about, I think flaxseed is great. We use it a lot, right? And I think using good oil is important. Nuts are amazing, in regards to the fiber and the good fat and all that. I think in regards to omega-3, I think the EPA is, again, they're usually, the ones you can buy over the counter if you're going to, buy an omega-3 supplement, which is fine. I think, the EPA and DHA are usually 1-to-1, ratio. The EPA is the one that, has been shown to have more of the kind of the anti-inflammatory, the chronic inflammation, it decreases that, or kind of, right? The DHA is more for the brain and, kind of long term, but both are good. But if you really are in a place where, and I would say if you're in there trying to tease out, I'm on 2-to-1 EPA to DHA ratio, you probably want to see a nutritionist, I imagine, but most of the ones are 1-to-1, and that's fine for what we are trying to get at into the population. Omega-3s, obviously, if you get it naturally, the better, right? The salmons and the fish, 2 to 3 times a week is plenty. That's all you need, really. But if you want to supplement, then omega-3 I think is great, especially for kids with triglyceride issues, right? And talking about cholesterol and triglycerides, you can do. I personally think that around the age of 10, you should start screening. And that was the last, the recommendations have changed a little bit. There's a little bit of confusing, and I think there's some confusion amongst pediatrician and family practice, physicians. the recommendations that came out about 12 years ago were really for, how are we going to find the people, that are have familial, hypercholesterolemia, right? And that's 1 in 250 for, heterozygous, right? The homozygous ones are the ones with the, cholesterol, 800, and those guys are getting plasmapheresis. And, honestly, those are rare, right? But the heterozygous,
for those parents out there, he's just talking about genetics and inheriting different heart predisposition to having early heart disease and myocardial infarctions, which heart attacks.
Right.
Sometimes
so I apologize. I apologize. I kind of had a doctor to doctor conversation there. So my apologies. So again, like for you and I both have I have familial hypercholesteremia, right? Even I tried 6 months of a really pure diet and lost 12% body fat, weight, not body fat, weight, and my cholesterol didn't budge, like literally 1, and I was annoyed. I was upset. Right. But that's familial, right? And that's the heterozygous familial, and and I take Lipitor,
and for those people, which I see at some points, and it's usually speaking to the parents, I love the Boston Heart Labs to determine if you're a rapid absorber. So you can talk to your doctor if you do know it runs in your family to discern what is the issue, whether you absorb or you don't clear it. Anyways, go ahead.
Right. No. And the adult guys are much more sophisticated in cholesterol, management, than in pediatric, right? So around the age of 10, I usually recommend that everybody, and that's a recommendation from the National Heart Blood Association and National Lipid Association, around the age of 10, everyone should have a non-fasting cholesterol, right? I mean, you don't have to fast for that first cholesterol if you're low risk, right? Your triglycerides might be high because they are affected by what you eat, but your non-HDL cholesterol, that's the bad cholesterol, will relatively stable, fasting or non-fasting. It gives you an idea where you're at, right? As a parent. Mm-hmm. And then really, I, over the years, I probably only have had maybe 5 to 8% of the children that I see in adolescents go on medication. So we try really hard. Now, again, there are kids with really high risk, right? If you have, let's say, type 1 or 2 type diabetes, right? If you have chronic, kidney disease, if there are other, high risk situations where our threshold is much lower for treating cholesterol, right? But my personal goal is not to give medication. I do. And when it comes time, but to go through the algorithm, and these algorithms change and get finer and better and more detailed, especially for kids, right? Unfortunately, the data for adults is so much better, right? So we kind of extrapolate that data and bring it down, right? So there is actually an app that the American College of Cardiology has. You can go in and put all your risk factors in there, right? You put your total cholesterol and I use that for my teenagers, right? And it gives you a 5-year, it gives you a lifetime risk, right? And then it gives you recommendations. It's relatively easy, right? And I use that all the time.
After this talk, either you can tell me and we can add it into the comments.
Sure.
How to get that app.
Yeah, no problem. I can definitely. Yes, and anyone
can use it. American Heart Association.
It's American College of Cardiology. There's an app, and it's and anyone can download it. Some of it is technical, right? But for the cholesterol thing is not. I mean, you put your age, your cholesterol. If you're a white, Hispanic, African American, if you're a smoker, right? It's for adults. But using it for teenagers really helps. It gives families an idea. What the recommendations are, at least for adults.
And I recommend MyFitnessPal, which you sometimes have to fake your age to get. Have you ever seen that? That's a great app where it tracks calories in, out, and your activity. And then it tells you where you are. Oh yeah, MyFitnessPal is, I want to, MyFitnessPal. It connects to a whole bunch of other apps, and it just keeps track of how much you're walking. You put in whether you're sedentary, whether you're active, but you have to be a certain age. And I do love recommending that they have a parent set it up with them and track only for a week or two, just so they know where they are. And it will put in saturated. You can actually, when you track your diet correctly and it automatically populates, you'll know how much saturated fat, if you're getting too much calories from fat and that kind of situation. and
Yeah.
sugars.
I think at the end of the day, you just want to empower, I think, families who are willing and who are wanting,
Yeah.
right? Which is unfortunately not a huge percentage, but the ones who really want to make a difference for themselves and their children, you want to, and now there's so many good resources, that, you just have to, push them towards those resources. And I think, and your practice obviously has been doing it for years. And, I've started using it, a lot of the internet and, over the last, 10 years. And most parents respond well, and most kids respond well.
I'll tell you, I think I ended up in concierge medicine because it seeks out people who want to do well for their children and provide a good, healthy background. And I was so exhausted at certain clinics, kids coming in with Cheetos and their Coke. And I told them that next time, I told them what they need to do and how serious it was. Next time they were in, just next month for a weight check, Cheetos, thing. Or the families, I'd lecture and then I'd see them on the street next to the clinic where I'd be helping, and they would have Slurpees after, it's exhausting. So I do have this fortunate situation that I don't think most doctors are able to enjoy, where my patients want to know and they want to hear it and they want to change. So that's really for anyone listening who's even interested in learning. It's just great when I have a family. If you want to do right by your child, this is the most important stuff, heart health. It's going to be important for the rest of their life. And I can't keep my mouth shut. I see it when my friends are feeding their kids. I'll gift them, I'll literally send them fish oil, that's palatable for a little kid, especially when I know it's in the family. It's just so important.
Yeah, I know, and and whatever we can do, again, I mean, we are fighting a corporate America here, and you and I, as physicians, we really do want to, do well and do good for our patients. But again, when you're fighting Coke and Pepsi and craft foods, it is so exhausting, because all they see is commercials, all they know is fast food and preservative, rich food, and and no one ever subsidizes apples. I wish we could subsidize apples instead of corn, But yeah, no, I mean, I applaud you, and I think for us in cardiology, I do have a little extra time, obviously, just because as a specialist, right, to spend with these families, and and I can and I do, and but it's important, it's important for all healthcare providers to, but parents have to be receptive, and that's the biggest thing.
So we've almost gotten through our preventive tips, and then I'm hoping you'll talk about pediatric COVID cases and what you're seeing, even if you know what's going on with the adult cardiac COVID-19 cases. But one thing I want to mention, the difference at my practice is, like I said, I get to roll my sleeves up and get really into the history and prevention and talk with parents and spend time with parents. So if a family is willing, because we're drawing blood for other reasons, to look at a lipid profile at 3 or 4 years of age, and my two reasons would be either the child is overweight and we're going to look for TSH and other things, or there's a family history. There's nothing wrong with that, correct? Checking HDLs and LDL, and it might not be dictated by a national standard, which probably couldn't afford that on a Medi-Cal system. But if a family finds that they want to get this screen, I mean, because that's really how we determine our screening, risk versus reward and prevention. So
there's nothing wrong with it, and I think that it will give you some information, obviously, not that again, but before the age of 8, Europeans have brought it down to the age of 8 for treatment with statins, the Lipitor, and that's basic treatment for high cholesterol that's not managed by lifestyle. And America, here in the U.S., I think 10 years old is the lowest, right? I think if the family is motivated, and I think that if they see that the numbers look good, or the numbers don't look good, especially if you're worried about familial hypercholesterolemia, like the genetic kind, then maybe I think that then the family can work even harder, I think, and try to mitigate the risk factors, right, that go along with our lifestyle. But no, I don't think there's anything wrong, and I think that some people do push it to 2-3 years of age. The recommendations are, if there is significant family history, you should have it at 2 to 3, right? Because then you get away from the, the whole milk, and then you go to that.
Exactly, yeah.
Right.
So there's nothing wrong. And I also will say, you know what? Now we know it's bad. If your child comes back and you have committed to these lifestyle changes, we now won't have to, it's motivation for a young child too. We're not going to do any more blood draws as long as because this is how serious it is. We need to check what's going on inside your body. That's a mechanism to get to the parents too, to help them understand how serious this is. So that's why I do go there, because some people won't equate their actions of feeding certain foods with what's going on to the child's heart and cardiovascular. So I'll get them. Their motivation to stay healthy is, I know it sounds evil, but I won't do another blood draw. If they're staying on task, then I don't have to worry, because I would never do a statin at that age. But if it's getting worse, then I need to refer to a cardiologist and figure out what else is going on and that kind of thing. So I do like checking. I mean, for any of my patients who are listening, it's been a conversation that everyone's had at a certain point. I kind of get shocked if they're early teens and we haven't checked, and once in a while it slips through the cracks. So I hope parents who are listening tell their pediatrician, hey, I don't know what my kid's lipid profile is. Can we check? And they should say yes. It should be covered by insurance, 100%.
Oh, definitely. And I think, by the age of 10, 11, the preteen years, if you haven't had it checked, even without risk factors, even without familial risk factors, genetic risk factors, you can, pinpoint in the family, I think every child deserves, a lipid profile, and it can be non-fasting, if they want to, they can't, have to eat breakfast before you go to the lab. That's okay. You'll get useful information out of that.
Great.
Obviously, if it's elevated, it's concerned, then you have to go through the, then you got to go non-fasting, right? I mean, you have to go fasting. And so there are definitely things, but I agree. And I think it's, if the family is motivated, the more information they have, the better they'll do, in regards to try to mitigate those risks.
Thank you. Anything else you want to add before I move on to just sharing what you've seen and learned from COVID-19 in pediatric heart conditions, or what you're hearing from the adults regarding these cardiac arrest cases? I know that I have a patient who's a LA Fire Department, and he says some days it's up to 3 cardiac deaths in 40 to 50-year-olds a day, and all COVID related. But of course, they're not forensics, and they just know that they were coming to a house where there was COVID, and that they could not resuscitate at the time they arrive. Yeah.
No, I mean, so it's still, we're doing this for a year now, so the data is obviously not the most, rigorous. But the things we've seen, at least in a pediatric population, obviously having, underlying cardiac and lung disease, right? So those kids who have significant, history of lung issues or prematurity or chronic lung disease, and, we obviously take care of a lot of the kids with significant, heart disease. Those are a little bit of a increased risk for getting sicker. Interestingly, actually, obesity has been from very early on. Obesity was shown in adults and in our younger, teenagers. Teenagers as well. Obesity to be a problematic. And those kids were at much higher risk for hospitalization, intubation, and more, kind of, severe disease. And the thought from the critical care folks who are taking care of these patients, they think, even without any comorbidities, meaning, they're not diabetic, right? I mean, they're just obese. They're not diabetic. They don't have heart issues, right? They think that, unfortunately, it's just the lung volumes. There are, if you're obese, the lung volumes are small, so, lower than a normal. And so they think that that's why they have so much kind of higher respiratory issues. In regards to actual heart disease, we do see the multi-system inflammatory syndrome, right? MISC, which people have kind of coined for the pediatric world, in children. That definitely has a cardiac component to it. And we're seeing this, it kind of looks like Kawasaki, right? It's just that inflammatory, febrile illness. And so it can affect the coronary arteries, right? And so just like any inflammation, like Kawasaki can. And you can get, inflammation of the heart muscle, right? That's myocarditis, right? So we do see it. Deaths in children and adolescents from COVID is extremely rare, right? It's not that common. And again, a certain percentage get sick, hospitalized, and a lot of those do well. Now, if you've been infected and sick in the hospital, in the ICU, intubated, right? those kids usually do get very close follow-up with, even if your heart was normal, even if your coronaries were okay, you're getting a very close follow-up with cardiology for a few months, like we do in Kawasaki, disease, and just to make sure the coronaries don't get involved. Long term, do we know how people with COVID, be it symptomatic or asymptomatic, really how are they going to do? Actually, I just was reading, there was a press release about that. There's the Boston Children's and Children's Hospital in Utah are starting this kind of prospective study to look at 100 children, adolescents with COVID for the next 5 years, right? To see what are we dealing with, right? I mean, how is this going to affect children, adolescents moving forward, right? So there's a lot of data. There's a lot we don't know about it, right? But those few things I mentioned is kind of what we observed.
And it is true that, and you can speak to this better than I can, that it's still small numbers, but we are seeing it here at the children's hospitals in Orange County and Long Beach, correct?
Definitely.
Definitely. Syndrome. Mm-hmm.
Yes, those the MIS-C syndrome, the multi-system inflammatory syndrome in children. Yeah, I mean, with the, whenever there's a peak in the community, right? So when the adult hospitals get full, which they were at 3, 4, and their numbers are coming down again. But so whenever that happens, we definitely see a surge in the children's hospital, be it in Orange County and at Long Miller, Children's Long Beach, and so a lot of kids get there again. Some come in asymptomatic, go home from the ER, right? Maybe a little fever. Some get admitted to the floor and they get the remdesivir, right? And they get the the steroids, or there's a protocol. And then some are in the ICU. So this very small percentage go to the ICUs and are really sick, right? So a very small percentage have the MIS-C that requires ICU stay and multi-organ kind of involvement that need time for them to get better from the inflammation.
And the risk factors tend to be somewhat similar to what you were just saying for the obesity and the heart condition, or is that not true?
I think the risk factors to get the ones who are very symptomatic, who end up in ICU, again, I mean, we're generalizing, but it appears that obesity seems to be a risk factor, right? And the underlying heart and lung issues are risk factors, right, for getting sicker. Obviously other things like diabetes is a risk factor, we know, in adult and pediatric population, right? Mm-hmm. But this virus is interesting because, like any other virus, we just, for example, one of the children we take care of is a 19-year-old with significant heart issues. His function is poor. He has pulmonary hypertension, severe pulmonary hypertension. He's on 6 different meds. So 3 for his pulmonary hypertension. So his lung pressure is really high, right? His heart function is very poor. And he showed up with COVID-19, right? Mm-hmm. And he's on, oxygen at home, right? He came in and we all thought, oh my God, anyone's going to not make it, right? So he came in, he went to the ICU, he required a little bit more oxygen for a few days. Uh-huh. He got his remdesivir, he got his steroids, he got his IVIG, and literally he walked out in 10 days with his, at his baseline condition. So, but again, you never know which way things are going to go, but the risk factors are, right now, those are the risk factors we know.
But you also come into it with the knowledge of how bad it could be. Anyone else hearing this could say, oh my God, 10 days in the ICU, that's still intense, but he did well, thank goodness.
I mean, 10 days in ICU for him, I thought he would, personally, I didn't think he's going to make it. I mean, when he came in with the COVID, with the positive COVID and the mild symptoms he had in his chest x-ray, but it's still
that because I think some people get excited that this really is almost fake and people do just fine with it. I have people in my family who think I'm exaggerating and that people should not be masking and distancing. So I just wanted to reiterate that
let me
in the ICU.
Yeah, no. Let me clarify. This the virus. I just know because people think, this really sick child did okay, but I'm just telling that was just an example of how this virus, anyone can be affected in any way. It's still a virus and everyone responds to it differently. But overall, though, I think it is much more severe than the just regular flu, even where people can get sick. So hopefully with the vaccine and with us continuing to do the social distancing and the masking, we'll get through this, and hopefully by next this summer maybe we'll have some semblance of normalcy, whatever that might be moving forward.
So we've reached 3 o'clock. You're welcome to stay and talk about anything we might have missed. I did want you to speak to how people could come see you for maybe EKG screenings, sports screenings. People at PPO can come see you for a consult if they have concerns. We didn't get time to talk about vasovagal and orthostatic hypotension, which tends to be a common question that I see. But
Sure.
we could do a follow-up talk if you want. If you want to say any final comments, go ahead. This was been super helpful for me.
Yeah, no, I appreciate it. Thank you. No, I mean, I'd love to maybe, yeah, whenever we can have another talk. And actually, I do see a lot of kids with, vasovagal, dizziness, orthostatic. So that's a topic we can definitely delve into a little bit. And if you want, next time. In regards to, yeah, so I mean, our main office is in Orange, right? We're by Chalk. And it's Pediatrics Cardiology with an X at the end of Southern California. And, again, we take most insurances and, either PPO, and it doesn't really matter. But you can always call our office. We'll be more than happy to see you for preventive cardiology, if there's lipid disorders, hypertension, obviously all the stuff that we just talked about today in regards to preventive cardiology. And we do work with our endocrine folks here at Chalk. So we definitely have our resources here as well that we can tap into if it's out of, my level of expertise. So.
Well, wonderful. I've been to a few talks that you and your colleagues have given, and it's been so helpful for me navigating decisions about high cholesterol, cardiac murmurs, etc. So I appreciate all you do for the community. And if anyone wants to find out more, we'll post a link to your website, which I did I'll put it in the comments here too.
Okay,
so,
great.
Yeah, thank you so much. This was wonderful. This was a big deal for me, launching my first doc talk. I really hope to combat the mom blogs out there with misinformation. So that's why I'm doing it. It's a lot of work and time for us, but it's what we need to do to educate the public from the inside of a medical office.
Yeah, no, I appreciate it, Vivi, Dr. Vivi, and I think that, we try those 10, 15-minute blocks that we have with our patients. Sometimes it's just not enough. And I think we need to be out there and, giving good advice, and hopefully that people, there's a lot of information out there. So hopefully we can at least try to give them the best information as possible. So this was fun. I really enjoyed it. So if there are other topics that you would like to discuss, I'll be more than happy to do this again. This was great.
You're getting a thank you from the comments as well.
Oh, well, thank you.
So, all right. We'll talk again. Thanks again.
We'll talk
Bye-bye.
again. Thank you. Thank you so much.
Sure. Bye.